Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The mounting of diagnostic casts can be divided into three areas. The first step in mounting even partially edentulous cast is to transfer the maxillary cast to the articulator with a face bow. A jaw relation recording base may be necessary if the maxillary arch is partially edentulous. However, in this case, the maxillary arch is not partially edentulous. The second phase of mounting cast, partially edentulous cast in the articulator, has to do with the recording of the centric jaw relation. Centric relation is the position that we'll want to record, and the problem, as we mentioned previously, was that when seating cast into the bite, it may have a tendency to rock. The cast may have a tendency to rock either with a bite or when they are placed together in centric occlusion. So in the posterior area, we have fabricated a centric jaw relation recording base, and this is the white acrylic base plate, and to it we have added, with just pink base plate wax, an occlusion rim. The base was fabricated to support the occlusion rim, and the rim is the part of the base which is going to replace the missing teeth. In other words, we're going to rely on support from the wax and the interopposing wax record to stabilize the cast. Now, the first thing that we want to do is to check this fit in the mouth on the patient. Now, this should be comfortable to the patient. It should not cause any pain. If there is any pain or any pressure spots, they should be relieved. I'm checking for the stability of the base by pressing directly on the base. Now, the base should be stable. I will look to see that the clasps are not infringing on the soft tissue, and that the clasps are retentive. The peripheral borders of the base should be short of the tissue reflections, so that when the cheek and etc., lip, tongue is manipulated, the base stays stationary and does not move. So it should be the base should be cut short of the tissue reflections and tissue connections. So we've checked the comfort. It is not causing any pain, which may cause a deviation of the jaw for the patient. The base is stable. I'm putting pressure and it is not moving. The clasps are retentive. Now, we know that we're going to use the base for to use the base in the mouth with a centric jaw relation record. That means that the bite relation will be taken at an open vertical dimension, so as not to let the teeth take over and slide. So one thing we're going to have to do is to key this area. It will record much more accurately. It will fit together better with the record that we're going to make if we will key this by cutting some slight grooves about 1 millimeter deep into the wax record. It's just to offer a more definite seat for the record. This should then be lubricated slightly with a Vaseline. I have this Vaseline on my finger. or some sort of sterile lubricant, so that when you're taking the records, the waxes or the pastes do not stick to the occlusion rim. Another important checkpoint for the wax occlusal rim, is that it doesn't interfere with the occlusion in any way. So we'll ask the patient to close. Now open. And I'm going to place the cheek retractor in. And now close. Chin up. And the occlusion should not come in contact with the pink wax at this point. We want to make room we want to have room here to ensure that the teeth striking the wax does not cause a deviation of the jaw. We should also check to see that the area of the jaw relation record base, this base, is not interfering in the posterior near the retromolar pad area, particularly if the patient is partially edentulous in the maxilla or fully edentulous in the maxilla. Whenever checking jaw relations, we want to make sure that the recording bases are not going to interfere with the position that you are going to record. This is extremely important. Okay. The next thing we would like to do would be to fabricate the interocclusal wax record for the centric relation bite. Now, because the bite is going to be handled slightly differently than it would if you were to take just a centric jaw relation on a fully dentulous patient, we're going to want to reinforce the wax record. Now, this is a wax record that is, you can see the reinforcement with a piece of metal. Now, the metal that we use is an ash-type metal, and it is easily cut. It is easily cut or bent, and it's just merely cut so that it does not interfere with the teeth in any way, shape, or form, and it is put into the tongue space. So you merely, after heating the wax, you merely take the little piece of metal, put it in between the wax, sandwich it, and then trim the wax away to the maxillary caste or to the edges of the teeth. You can do this right from the caste. It is not necessary to take this to the mouth. And the wax that you will end up with, the wax record that you're going to record with, will look like this. And it is approximately 2 thicknesses in depth. And the wax that we're going to use is the high melting temperature wax for recording wax bites, so that it doesn't distort as easily as the regular base plate wax. It is an extra hard base plate wax. Now, before recording the preliminary centric relation bite, we would then take this to the water bath, which is set at about 138 degrees, to soften it thoroughly. When the wax has thoroughly softened, you may take it and apply it first to the maxillary arch. Notice it's much easier to do this when the wax has been pre-cut to the cast. You can see the shape very nicely and adapt it to the edges. And then we can register the patient's centric jaw relation. I'm going to hold now. Now, it is absolutely necessary that you hold the patient's jaw into the centric relation position so that the musculature and or the guidance from the teeth in wax does not occur. You should hold it while the wax bite chills. If you have an assistant, she may either rinse with cold water, or she may also blow air on it to facilitate the chilling, but it should be chilled thoroughly before removing from the patient's mouth. When the wax has chilled, we'll remove it from the mouth and then examine it for any perforations. Now, the indentations of the maxillary teeth and mandibular teeth should be there, but there should be no perforations of the wax. And if we look at this carefully, we're thin in this area, but we're not perforated. We're not perforated at all. And so this should be adequate if we have the jaw in the correct position. The physical part of the wax bite is okay. Now, the area that is opposing the occlusion rim, opposing the partially or the edentulous area, should now be relieved, because even though the wax was thoroughly softened, it is very possible that the wax would displace the occlusion rim, which is resting on soft tissue. This is done by cutting away the contacting waxes with a scalpel. I'm cutting the chilled wax away. This is where it comes in very handy to have some sort of support in the midline, such as the metal, the ash metal. I'm going to place this in the mouth to make sure that the wax is not touching the occlusion rim. You can see in the posterior area I've cut away, and this area we are going to wash with a bite registration paste. We'll place the paste on the interocclusal record and then reposition the jaw so that we are actually recording the support of the base at rest. It won't be placing any undue pressures on the jaw relation recording base. Okay, I'm going to remove this. Now, we would use a Kerr bite registration paste, and only a small amount is necessary, and it is mixed rather rapidly, incorporating equal amounts. And only, I must impress upon you that only a small amount of this is going to be applied to the wax record. This small amount, all we really need is to record a very small portion of the occlusal surface of the wax occlusion rim. Now, it is inserted. Now remember, we have lubricated that occlusion rim already so that it does not stick to it. We position the jaw in the same position that the wax dictated previously, but now we are recording this posterior area with the paste without any pressure on the base. Now, we'll wait until this sets up rigidly in the mouth, and it should take approximately 2 minutes. When the wax and the paste are both set, open, we'll remove them from the mouth, and now we're going to inspect the area that we have just recorded in the bite registration paste, and we see the 2 grooves that we had cut into the lower occlusion rim, and it seems to be nice and clear and well defined. If there is an excess in great amounts, we would cut it both from the buccal and from the lingual so that the cast and the occlusion rims would more easily fit together. Now I'm going to remove also the lower occlusion rim, and we're going to see how everything fits together so that we may mount the lower cast in the centric jaw relation position. The lower cast we used for fabrication of the jaw relation occlusion rim and jaw relation occlusion base, so it fits well to the base and does not rock. That was one of our criteria. Now, all the teeth should be inspected for any bubbles on the cast, and if it is free of bubbles, we're going to try on this wax and paste ZOE record, and we see that it fits rather nicely. You look at the buccal surface and the labial surfaces to make sure that it's fitting well into the inner occlusal record. Remember, the first part of the mounting procedure was to mount the maxillary cast with the face bow. Now we're going to fit everything together. The maxillary cast should be checked for bubbles too, and we know that that's free of any bubbles. And then the mandibular cast, you can see, keys in with the use of the inner occlusal record and the jaw relation record base, and the cast is now very stable. They're stable. I'm putting pressure on it, and you can't rock the cast. Now, this is what we are using this jaw relation record base for. Now, the centric jaw relation position requires the inner occlusal record to be made at an increased vertical dimension, but this should be of minimal error. It's an arbitrary mounting of the face bow, of course, but it should be mounted in centric jaw relation for the diagnostic cast. Diagnostic cast should be mounted in centric jaw relation. However, if the centric jaw relation is not desirable, then we can mount into the centric occlusion position. Perhaps in isolated cases, it would be desirable to use the centric occlusion position for the mounting of the mandibular cast. Now, we can also use a jaw relation record base, first cut short of occlusion. Now, if we look carefully, we remembered that we cut this short of occlusion. It was tried in the mouth. Now, when we used the centric jaw relation, we wanted to lubricate this base. Now, if we're going to use centric occlusion, that means that the remaining teeth would have to be in maximum interdigitation. So what we would use would be to add the bite registration paste to the lower rim. You can see, as we've done here, this has already been made, a centric occlusion record that has already been made. And I'd like to show this in the mouth. Now, the difference being that now we're registering the centric occlusion position. And the centric occlusion position states that the remaining mandibular or dentition be in maximum interdigitation. Okay, now close together. And this is a record taken at the correct occlusal vertical dimension. If we look in the posterior area, we see that the paste fits very nicely against the maxillary dentition. But that the difference being is that this is centric occlusion, and now the remaining teeth are in contact, and this is a position dictated by the teeth and musculature and not by the joint or manipulation of the jaw. So a centric occlusion record can be made with the use of the centric relation record base, or a jaw relation record base, I should state. Now, that would take care of mounting the maxillary cast and the mandibular cast mounted either with the centric relation or the centric occlusion record. Now, the third thing in mounting procedures were never completed, and that is to take a protrusive record to characterize the articulated cast according to the patient. So a protrusive record is, we're not going to perform this in any different manner than you would on the dentulous patient, but the record should be thicker than the centric relation record. If we compare this record I fabricated with 4 thicknesses, the protrusive record of the hard faceplate wax, and the centric relation record was fabricated with 2. So if we look at that, we can see the difference in thickness. Now the protrusive record, we know, is made about 4 to 6 millimeters forward of the centric jaw relation position. It is, we do not allow the teeth to come together. The jaw should come together in a straightforward position. Now we've done exactly the same procedure as we have with the centric relation record as far as the mechanical fabrication of it, but this protrusive would record the protrusive jaw relation. Now we're going to look at this in the mouth. Now we have the lower occlusion rim in, and try and find that position here. We see that this is the protrusive patient, or protrusive position on this patient, and we also use the jaw relation record base to stabilize the cast so that you would get an adequate recording when setting the articulator. And that is done identically to the dentulous patient, or the dentulous cast. So now we have everything we need for mounting of diagnostic casts: the faceplate transfer, the centric relation interocclusal record, and the protrusive record by which we're going to characterize the articulator to this given patient.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.